when I'm doing it, but Fowler's is different.
Okay. Which one is that one? That's just
So that's the passive range of motion. So the next one are the provocative. So we got the impingements.
Winging of scapula, then impingements.
Okay, so we already kind of did the winging scapula. And they teach you to do a push-up on the wall to do that. That doesn't work for anything. I think that forward flexion and then seeing how it tips, that's a lot more provocative for a long thoracic nerve palsy, where you're going to get that scapula that wings up. Then the next one was
Impingement.
okay. So we got the anterior impingement, which was we did the near test already, which was this one, and then Hawkins test, forward flex, internally rotate, and then you bang the supraspinatus on the acromion. Biggest mistake people do is they do it out here, and that doesn't do it. So you got to get forward flexed here to put it in. And then the posterior impingement is the same as the anterior apprehension. So as you're going back this way, you're pinching on the back side here. So it's like you put them in the apprehension and they go, ow. The question is, where does it hurt? And if they point here, you think posterior impingement. If they go, it kind of hurts in front, then you may be having apprehension and some anterior instability. So it's kind of a twofer. So is the next one cross arm? Biceps tendonitis. So hand out straight. This is the one where you have them put their hand out like they're asking for a tip. Don't let me push you down. And that will reproduce their pain right up and through there. So if that one is normal, then you can check the labrum test, which is O'Brien's test, which you put thumb down and then 45 degrees of adduction as opposed to supraspinatus, which is 45 degrees of extension. And then you push down through here, and as you do this, that'll reproduce pain right along that anterior joint line.
That's O'Brien's?
That's O'Brien's.
You would have pushed harder. The
first one's positive, you don't have to
Wait, so it's like
So if Speed's test is positive, if Speed's is positive, O'Brien's is going to be positive. So you have to do it. So the crank is like doing the McMurrays in the shoulder.
Yeah, you're right.
Seeing if you can feel anything pop or click. So the next one is it cross arm adduction?
Yeah.
Correct.
Okay, so cross arm adduction gets you two also. So again, the first thing is you bring it across, and if you have an AC separation, it hurts right over the AC joint because you just mashed the things together that just got torn. And if that kind of bothers them a little bit, and you have them push their elbow against your hand and push against me, so what that does is it now makes it a fulcrum, and it really jams it together. So again, it will reproduce that, but this is also the same one for posterior instability, where when you push here, that posterior humeral head.
Which direction are you pushing? You're pushing back?
So he's pushing toward me, and you do that, this kind of slips right back out, and then you bring him back out, and it goes clunk right back in. So this is kind of a twofer, again, provoking the AC joint, but provoking also posterior instability.
What is that called?
That's the cross arm adduction.
Is that anterior impingement?
It is.
Same position.
Okay.
Same position, but yeah, instead of doing this, he's pushing out against me.
I see. Wait, so when you're doing everything, I'm trying. No,
You can do this one after.
you're flying?
Internal rotation there. And so you want to make sure, because it's going to reproduce the pain up here, or give you that deltoid tubercle referral pain through there.
If you have someone do it on you correctly, you can feel the differences.
Okay.
So we talked about AC, the cross arm adduction. So we're doing that posterior instability. We might as well do the posterior apprehension, which is forward flex and internally rotated. And you hold the scapula here so that your posterior joint line is like in the small of your hand. And then you push back here, and it goes flunk, and they don't like it.
You push where?
You give them an axial load,
Oh, okay.
and it pushes it out posteriorly.
This is posterior drawer.
No, this is actually the
Apprehension?
posterior apprehension test.
The drawer is just like
Right. So there's also one called Kim's test, which you bring them into abduction and 90 degrees abduction, and as you extend them, you push down like this, and it pops out backward.
And that's testing for instability?
That's another one of those posterior instability
Okay.
tests. So there's a whole bunch of ways you can put somebody out posteriorly.
Did we do anterior apprehension?
No, we didn't. We kind of jumped ahead because we did posterior impingement, which is the same as anterior apprehension. So that's this one here, and they don't like that because as you go into here, it's going to make their humeral head go anteriorly.
So posterior impingement is the same thing as anterior apprehension?
Correct.
Okay.
It just hurts in a different way and it feels different.
Yeah.
So we did all the impingements, all the apprehensions.
Did you do
We did.
sulcus sign?
We didn't do sulcus. So the sulcus sign, this is along with the anterior and posterior drawer. So you have them relax. Put your hands on the acromion here, and then you'll pull down through here, and you'll see a little opening through there. That's the sulcus. And then you grab the humeral head, and then you push posteriorly, which makes it go out this way, and anteriorly, which goes out that way. But you got to grab the humeral head through there.
So that's like an opening in the glenohumeral?
That tells you that they have increased translation. So it may, and especially if it's asymmetric, this one's normal and this one has more. It may go along with you stretched all of those capsular ligamentous structures, and that's why it's going out anteriorly.
So is it kind of almost like a drawer test for the...
Just like the drawer test in the knee and in the ankle. It's just means different things. So we've got all the drawers, the sulcus.
Did you do Fowler's relocation?
That's when we lay them down. So I think that's the last one. So the last one is Fowler's,
Wait, but what are you looking for on sulcus again?
just to see
How
extra.
much you do the drawer?
So we will do this gently. This is what you're looking for.
Yeah, it slides down.
See how it goes out
People
inferior.
won't have it.
Yeah. So that just means that she has increased translation, which means if she's a swimmer or a thrower, those things, her rotator cuff has got to be spot on to control, so she's not banging into things because her capsule is not going to hold her as she needs to be. Okay, so the last one is Fowler's. So Keith, can you lay down up here for me? Yeah, that hurt. Your shoulder right about there. Perfect. So Fowler's relocation test, you bring them up into 90 degrees abduction, externally rotate to here, and they start to say, hey, that kind of hurts. And if you push in through here, it puts the humeral head back in the glenoid, and it's, hey, that feels better. So that just means that they have a loose capsule forward here. For everybody. And this is the point where you can check external rotation here. You want to make sure that the shoulder's in the same position, and then internal rotation here. So we kind of jump back to that passive range of motion one. But I like doing it here because now they're laying flat and you take out some of the variability.
So it's called Fowler's.
Fowler's relocation test.
Is that what you would use to relocate a anterior displacement?
Nope,
Just
nope,
called
nope.
that.
So that would actually reproduce. You could put somebody out theoretically that way, and it will feel better when you put it back in like that.
Have we gone over that yet? How to do relocation?
I don't think we
No,
have.
Okay.
No. Thank you.
Is that what you just like, are we going to learn how to put in a